Hi there, Sam. My name's Mel. I'll be your student nurse and I'll be taking care of you today. And today I'll be doing a simple head to toe assessment. And the first thing that I'll be doing is taking your vital signs. So first I'm going to take your temperature here. And your temperature is 96.6. And next I'll be taking your pulse. Can you put your arm out, please? All right, and I'm gonna take your pulse for 1 minute. All right. All right, and your pulse is 82 beats per minute and respirations are 15 per minute. And next I'm going to take your blood pressure. Can you put your arm out and put your palm up? There you go. Thank you. Alright, and your blood pressure was 135 over 80. Okay, Sam, now I'm going to do a general survey. And just by looking at you, you're breathing effortlessly. You seem content and relaxed. You look like you're at a healthy weight. You're clean and well presented. And you have good posture and no physical deformities. And next I'm going to assess your skin. So if you could just put your arms out. Okay. So, just looking at the color, your skin is pink, and then you don't have any rashes or lesions on you, okay, and your skin is smooth, and your temperature is warm, and then I'm going to assess the turgor, and your skin bounces back quickly, okay, and now I got to see if you have edema in your ankles. And there's no edema present. Okay, Sam, now I'm gonna evaluate your head and your facial structures. And just by looking at you, everything is symmetrical. And I'm gonna inspect your skull on your hair. Okay. And now I'm gonna palpate your temporal artery. And then your temporomandibular joint. Just open and close your mouth. Sam, now I'm going to assess cranial nerves 5 and 7. I'm going to make you do a list of things. Can you please squeeze your eyes shut? Okay, you can open them. Can you wrinkle your forehead? Can you clench your teeth? And can you smile? And can you puff your cheeks? Okay, and now I'm going to look in your mouth and throat. Can you open your mouth? Oh, let me grab my pen light here. All right, sorry. Open your mouth, stick out your tongue. Okay, and can you say ah? Okay. All right, and now I'm gonna assess cranial nerve number 12. Can you stick your tongue out and move it from side to side? Okay. All right, and you can put your tongue back in. And now I'm gonna inspect your eyes and your eyelids, and everything is symmetrical. And now I'm gonna inspect your conjunctiva. I'm gonna separate your eyelids and just look at your eyes. Okay. All right, can you look up and down, side to side? Okay. And just as a note, your sclera is white. Next, I'm going to assess your pupillary response. And then I'm going to assess your consensual light reflex. And both pupils do constrict. Okay, and then I'm going to assess accommodation, and I'm going to move the pen light closer to your face. And as I do that, your pupils will constrict to accommodate you looking. Okay, Sam, now I'm going to assess cranial nerve number 2. And can you step up and stand about right here and look at the Snellen chart? And then what I need you to do is cover one eye and read from the E as far down as you can, and then repeat with the other eye.
E, F, P, T, O, Z, L, P, E, Z, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, Z, C.
Okay, can you repeat with your other eye?
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C. Okay, you can sit back down now. Your ears, and I'm going to assess cranial nerve 8 by doing the whisper test. So just by looking at your ears, they're symmetrical, and I'm going to palpate the auricle here, and the lobe, and the tragus. Okay, and now I'm going to perform the whisper test by assessing cranial nerve 8, and what I'm going to do is I'm going to occlude one ear and then whisper 3 letters or numbers, and you're going to have to repeat them back to me. Okay? Mm-hmm.
5T9.
5T9.
Okay.
2L1.
All right, perfect. And now I'm going to assess nostril patency. So what I'm going to do is I'm going to occlude one nostril, and you're going to have to sniff, and then I'm going to repeat on the other side. Okay? All right. And now I'm going to palpate your sinuses. So I'm going to palpate the frontal sinus. Okay. And then I'm going to palpate the maxillary sinus. And is there any tenderness?
No.
And now I'm going to inspect your neck, and I'm going to test the range of motion. Can you raise your head up and put your head down, raise it back up, and then can you shake your head side to side? Okay, and now I'm going to palpate your tracheal. Okay, and it is midline. And then I'm going to palpate the carotid pulse and inspect your jugular veins. Okay, Sam, now I'm going to palpate your lymph nodes. So I'm going to palpate the preauricular, the postauricular, the occipital, the posterior cervical chain, the tonsillar, submandibular, submental, anterior cervical chain, and the supraclavicular lymph nodes. Okay, Sam, now I'm going to assess your mental status and level of consciousness by using the Glasgow Coma Scale. And first, I'm going to start with your eyes, and they are open and blinking. And next, I'm going to ask you 2 questions. What's your name?
Sam.
And what month is it?
May.
Okay, so for verbal, you're oriented. And then for motor skills, can you please shake my hand? All right, and you can obey commands. And your speech is normal, as I observed throughout this whole assessment. So I'm going to give you a level of 15, which is the best score on the Glasgow Coma Scale. And now I'm going to evaluate your upper extremities. I'm going to evaluate circulation, movement, and range of motion. So first I'm gonna assess your arms. So can you bring your arms out in front of you? And then bring them back as far as you can go. And then put them back to your side. Can you raise your arms to the side, palm down? So like this. Okay, and then raise your arms up and palms up over your head, like this. And then you can put your arms and hands behind your head and then behind your back. All right, next for your shoulders, can you flex them up and down and in front of you and behind you? Okay, and then can you circle them forward and circle them backwards? And then can you shrug your shoulders against my resistance? Okay. And next for your elbows, can you bring your right arm up towards your shoulder like this? Okay, and then lower your arm back down. And then bring your arm straight up, palm up. Turn your palm down and back down. And next for your left arm, can you bring your right arm up towards your shoulder and then back down? And then can you bring your arm up, palm up, rotate your palm down and back down? Perfect. And now for your wrists, can you bring your wrist and hands up like this? Can you bend them down and bend them back up and bend them all the way up? Bend them straight, bend them in, bend them out. All right. And then can you bend them up against my resistance and bend them down against my resistance? Okay. And next what we're gonna do is range of motion of your hands. So can you spread your fingers out like this and make a fist? And then can you touch your fingers to your thumbs together and then do it quickly? Okay. And next what we're gonna do is the finger to nose test. So what you're gonna do is I'm gonna have my finger here and you're gonna touch your nose and then touch my finger, and then wherever I move it, you're gonna do the same. Just like that. Okay, Sam, now I'm gonna test stereogenosis, and what this is I'm gonna have you close your eyes and then I'm gonna place an object in each hand and you're gonna have to let me know what that object is, okay? All right, here's the first object.
Key.
Okay. And then here's the second object.
A pen.
All right, you can open your eyes back up. So next what we're gonna do is I'm gonna test graphesthesia, and I'm gonna sketch a letter or number in each hand and you're gonna have to let me know what it is, okay? All right.
3. C.
All right, perfect. Now I'm gonna assess your breathing, effort, rate, rhythm, and pattern, and then I'm gonna inspect your chest shape and skin. All right. So you're breathing normally, and chest is normal shape. Can you just turn around? Okay, and your chest is normal and cone shape. Okay, you can turn and face me. Okay. And now I'm going to also take your breath sound, so every time I place my stethoscope, just take a deep breath. Okay? Okay, Sam. Next, I'm going to palpate your posterior thorax profundus. So what I'm going to do is I'm going to put my hands on your back, and every time I move them down, you're going to say 99, okay? So you can turn around. All right. You can say 99.
99. 99. 99. 99. 99. 99.
Okay, Sam, now I'm going to inspect the precordium of your heart, and then I'm going to also take the heart with the bell at the apex and the left sternal border. All right, so this is the apex. And then the left sternal border. Okay, and now using the diaphragm, I'm gonna also take the aortic, pulmonic, left sternal border, tricuspid, and mitral valves. All right. So here's the aortic. And the pulmonic. And Erb's point. And the tricuspid valve. And the mitral area. And epigastric area. Okay, and next what I'm going to do is I'm going to percuss the anterior chest from the apex to the base and sides. Alright. So I'm going to start here. Okay. And next what I'm going to do is I'm going to also take the carotid artery on the side of your neck. Assess the range of motion of your joints, and we're going to start with your hips since you're still laying down. So can you pull your right knee to your chest? Maybe just pull it to your chest. Okay, and you can put it back down. And then can you pull your other knee to your chest? Okay, you can put it back down. And then can you roll on your right side? And then bring your leg back. Okay, and then bring it back. And then you can roll back on your back. And then can you roll on your other side and bring your leg back? All right, you can lay back on your back now. Okay, Sam, continuing with the range of motion of joints, we're gonna start with your ankles and feet, and then can you point your toes up and point your toes down and turn your soles out and turn your soles in, and then can you rotate your feet out and rotate your feet in? Can you bend your toes down and bend your toes up? And then can you push up your feet with resistance? Okay, and then can you stand up, please? All right, and can you bend your right knee up and straighten your leg out? And can you do that with your left knee? Bend your left knee and straighten your leg out. Okay, and sit back down. And then what I need you to do is push against my hand. Okay? And now I'm going to palpate your thyroid. So what I'm going to do is I'm going to stand behind you. And then can you put your head down and turn to the right and swallow? Okay, and turn your head to the left and swallow. Okay, and now can you stand up, please? Okay. And then can you face out there? All right, and now what I'm going to do is I'm going to inspect your spine, and then I'm going to palpate the spine from top to bottom, and then on either side, and then palpate your scapula. All right? Now I'm going to also take the breath sounds on your posterior thorax. So every time I place my diaphragm on my stethoscope on you, I'm going to need you to take a deep breath. Okay, Sam. Now I'm going to test your musculoskeletal and neurological. So what I'm going to have you do is I'm going to have you do the heel to shin test. So can I have your right leg go down your left leg from your knee? And then repeat with the other leg. Okay, and now you can stand up. And now what I'm going to do is I'm going to assess your spine flexion, extension, lateral bending, and rotation. So can you put your chin to your chest and then bring your head up and look at the ceiling? And then can I have you look straight ahead? And then can you touch your one ear to your shoulder? Put your head back up and then touch your other ear to your shoulder. And then can you look to the right, look to the front, and then look to the left and look straight ahead? And then can I have you turn your head against my resistance? Okay. Perfect. And now can I have you touch your toes? Okay, and then you can stand back up and then arch backwards. Okay, you can stand right back up. And then can you lean to the right and lean to the left? Okay, you can stand back up. And then can you twist to the right and twist to the left? Okay, and the final thing that I need you to do is, can you just walk a couple steps on your heels? So like this. Okay, and then can you walk on your toes? Okay, and then can you stand on one foot? Put your foot back down and then stand on your other foot.